Breast cancer is a worldwide disease that accounts for 22% of cancers in women.
Prognosis and survival rates for breast cancer vary greatly depending on the cancer, type, stage, and treatment.
A parent should consider getting tested, not just for the sake and health of themselves, but for their family members, because family members are affected just as much as the person diagnosed.
This is why testing for breast cancer is crucial for a quick recovery.
My name's Frankie Heagle, and when I was in the 3rd grade, my mom was diagnosed with cancer, breast cancer to be exact. It's had a tremendous impact on my life. She was weak, she lost her hair. It was very traumatizing. It's not something I would recommend for an adult, let alone a 9-year-old boy. And I think it changed me in a lot of ways, made me very happy to have my mother around, and I appreciate every day she's there.
A lot of people are afraid of mammograms because they feel it is a painful procedure, and after hearing some experiences, they're just scared they'll be diagnosed with cancer themselves.
However, when you look at the alternative of long-term pain and suffering versus finding out what's wrong with you and treating it with some discomfort, the second is more reasonable and can keep you living a longer and healthier life.
I lost my mom to breast cancer when I was just 2 years old. My family history evolved into something very significant over the next decades. 2 of my maternal aunts had breast cancer, one of them twice. Both aunts were diagnosed, treated, and survived. 2 maternal cousins also had breast cancer. One was diagnosed very early, and unfortunately, the other was not and passed away at a young age. Then, I was diagnosed with breast cancer. After years of diligent testing, I had 2 young children at the time and could not think of anything else but surviving. With proper screening, many lives are saved because of early diagnoses and interventions.
Unless you show early signs of breast cancer or have a family history, the usual age for women to begin mammogram screening is 40 years old.
Still, even if you're under 40, you should check to make sure that you're healthy and fine. You should especially do this if your family has a history of breast cancer.
Self-examinations are very important. Examine yourself and see if you have any signs of cancer, such as a lump, an area for thickening, or a dimple in the breast.
It's crucial to see your doctor as soon as possible if you think you might have symptoms.
But even if you may have one of these signs, that does not mean you have breast cancer. Most bumps turn out to be non-cancerous.
My name is Diane Kreuter, and I just wanted to talk to you today a little bit about my background and how cancer has affected our family. Many years ago, I had an aunt die from breast cancer. My mom also had suffered from breast cancer 2 times in her life. She was a survivor. We didn't know why that was, but what happened, we found out, is that we have a gene defect in our family, BRCA1. Once we discovered that, we knew that we had to be more diligent with checking ourselves for the possibility of developing breast cancer. For me, my sister was not able to find her breast cancer till it had already spread to her lymph nodes and to her brain, and sadly we lost her. But in knowing this, my doctor was, as I said, very diligent about checking me, and I discovered I had a lump in my breast, and it was discovered very early. It was called in situ, which meant it was a tumor in a duct in the breast. So I decided to have a bilateral mastectomy. My children were very young at the time. It was found very early. I did not need chemo or radiation, but it was the diligence that we checked, and I had mammograms and ultrasounds more often that helped us to find it early. Cancer really hit our family very hard, and we lost some beautiful women from it.
What's important for women to remember when they go for their annual mammogram is that when they are positioned at the machine by the technician is going to tell them to lean into the machine. You're going to have them put their arm around the machine and hold on to a handle. The most important thing is just to relax. Relax and just lean yourself onto the machine, because the more you relax, the better picture they get and the less uncomfortable it is. But when women are anxious, their muscles are tense, that's when it will hurt. It will be much more uncomfortable.
Screening guidelines for women are as follows: a yearly clinical examination and a monthly self-examination. This does not apply to women with a significant family history of breast cancer.
Also, 1 out of 10 men develop breast cancer. Don't think you're excluded from this.
A cancer diagnosis is a devastating one, but the earlier breast cancer is found, the more effective your treatment options will be.
So contact your doctor and find a good place for testing today.